So what is retained placenta here? A placenta is said to be retained if it is not separated and expelled within half an hour to 1 hour after the delivery of the baby. So actually what happens immediately after birth? So immediately after birth, the placenta separates from the uterine bed, and within 15 to 20 minutes, the placenta is expelled out. So these are the normal timings. But if the placenta is not separated or expelled within 30 minutes to 1 hour after delivery, then we call it as retained placenta. What are the different causes of retained placenta? The placenta may be because of impaired uterine retraction. Post delivery, the uterus retracts, so that during this uterine contraction, the placenta is removed and it is expelled from the uterus. And second cause is sometimes there is formation of constriction rings. What is that? Sometimes there is formation of constriction rings. And third, very important cause is adherent placenta. Okay, the placenta is adhered, maybe because of infections, because infections occur due to the manipulations, right? Maybe because of infections, or maybe because of absence of decidia. So decidual absence. Decidia separates placenta from the uterine wall, right? If the decidia is absent, so this kind of placenta is known as Placenta Accreta. Okay, this is adherent placenta or Placenta Accreta. So these are the three causes of the retained placenta. Now let us quickly jump into the management aspect. Management of retained placenta. So what do we do when there is a retained placenta? First, wait for 15 to 20 minutes. Okay, after 15 to 20 minutes, if there is no bleeding, okay, and the vitals are stable, if the vitals are stable and there is no bleeding, you can wait for 1 more hour. So till 1 hour you can wait. So starting from 20 minutes you can wait till 60 minutes. No intervention is needed. So next, during this time what we have to do is, we may anticipate like the within 1 hour there may be an expulsion of the placenta, or sometimes what happens, we may need to do an intervention. So while doing an intervention, we need to do a blood transfusion. So we can use this valuable time to keep the compatible blood ready, and also we have to prepare the setup for emergency hysterectomy too. After 1 hour, let us say, so during the same period of 20 to 60 minutes, we can try a shot of oxytocin again. Okay, oxytocin helps in uterine contraction so that the placenta can be expelled. As I already told you, we can plan a blood transfusion and keep everything ready during that period. After 60 minutes, if there is still no signs of placental separation, or during 20 to 60 minutes, if there are bleeding and vitals are becoming unstable, in these two clinical scenarios, we may need to try a procedure known as manual removal of placenta. If you are writing an answer for management of retained placenta, so this term should be there in your answer. This is very important. What is that? Manual removal of placenta. What are the steps of manual removal of placenta? So let us write down the steps. The image here shows the procedure of manual removal of placenta. Very important. This should be done in an aseptic manner. Okay, we have to take all the aseptic precautions, and it is done under adequate analgesia, and we need a prophylactic antibiotic cover before doing this procedure. In this, the patient is placed in a lithotomy position. So what is the position of the patient when it comes to manual removal of placenta? It is lithotomy position, and one hand is placed on abdomen. See here, this is abdominal hand, and the other hand is brought into the shape of a cone. See the cone shape of the hand here. So the other hand is brought into the shape of a cone, and it is inserted into the vagina. Okay, the other hand is vaginal hand, which is brought into the shape of the cone. During insertion, the hand should follow the course of the umbilical cord so that it can enter into the free area of the placenta. Okay, so with this we locate lower end of placenta. What we are doing, we are locating lower end of placenta with a vaginal hand. After this, we do sweeping movements. With the help of a sweeping movement, the placenta is now getting stripped from the abdominal wall, that is the uterine wall. While doing stripping, the abdominal hand should exert counter pressure. So with this, there is a total separation of the placenta, and this is followed by an infusion of IV oxytocin so that whatever the placenta which is separated now gets expelled. Okay, and at the end, make sure that you check. So what do you check? You check for perineal tears, you check for any injury to the birth canal, and also we have to check whether the placenta is completely removed or not. So these are the steps of manual removal of placenta. So what do we do in manual removal of placenta? It should be done in aseptic, analgesic and antibiotic coverage, lithotomy position. One is the abdominal hand, other is cone shaped vaginal hand. With the help of sweeping movements, we have to locate the posterior aspect or the placenta, and we have to remove it, later followed by IV oxytocin, that is uterine stimulants, and then at the end we have to check whether the whole of the placenta is being expelled or not. Sometimes the placenta may be an adherent placenta, so we cannot remove it just with the manual removal, right? In such cases, that is in cases of placenta accreta. What is placenta accreta? There is absence of deciduea. Because of that, the placenta is completely penetrating the myometrial wall. See here, if let us assume that this is placenta and the placenta is penetrating into the uterine wall, the myometrium, this condition is placenta accreta. In this scenario, even if we do sweeping movements, we cannot remove the placenta, and we are actually harming, so that there is severe bleeding and shock and death of the patient. If there is any difficulty during manual removal of placenta, kindly keep it in mind, this may be placenta accreta. The adherent placenta, because of infections or inflammation, can be removed. But when it comes to the placenta accreta, this is very tough to remove. And what is the modality of treatment available to treat placenta accreta? We may need to do hysterectomy in these cases. So we may need to do hysterectomy in these cases. So this is management of retained placenta.